whether they're feeling ill or not.
Eden, thanks very much. Eden Wilson there with the latest from Belfast. Now, England's Chief Medical Officer has warned schools could close for 2 months or more in the UK if the spread of coronavirus intensifies. Danny Mortimer is the Deputy Chief Executive of the NHS Confederation. He joins me now. Good morning to you. How confident do you feel that the UK is prepared, the NHS is ready and able to deal with this as it intensifies, as it spreads?
So I think the first thing to stress is that there has been weeks of planning now that's been going into responding to this growing issue. We're still at a case, of course, where there's, of the 80,000 cases in the world, only 16 have thankfully been detected in the United Kingdom. The NHS is doing a huge amount to prepare, but there are also things that we can do ourselves as a population. We can maintain really good standards of hygiene, good hand washing, using tissues to catch our sneezes and coughs and so on. And also, if people do fear that they've got symptoms, the thing that they should do is ring 111. It's not about going to your A&E department or your GP surgery. It's about ringing and getting some advice, and if necessary, we'll come to you and work out what to do next.
I mean, we were hearing there from Eden, the person infected from Northern Ireland travelled from Italy via Dublin. I mean, there's a lot of talk about what checks are happening when people are coming into the country, and then what checks are happening for the people that they've been in contact with.
And at every stage of this sort of developing issue, the countries of the United Kingdom are working out what's a proportionate response. And at the moment, the best response that we can have is the one that I've described. It's about providing very clear advice to the public. It's about focusing our plans on making sure that our facilities are ready, that we are able to test people away from our main A&E departments and GP surgeries. Clearly, the situation in the UK is very different than if you're travelling into Italy, for example, or if you're travelling into China or the Far East, just because the scale of the problem in those countries is so much higher than it is here in the UK.
There's a lot of confusion about this situation of self-isolating, isn't there? If people have come back from certain areas, should they self-isolate? Should they wait to be told to self-isolate? Do you only need to self-isolate if you've had a test and it comes back? You know, what's the issue around that?
There is a lot of advice online. If people go to NHS Choices here in England or onto the various similar websites across the UK, there is very clear advice about what to do. Clearly, if people are worried, again in England, they can ring 111 and get very clear advice from someone over the telephone about what it is they should do if they're worried they've got symptoms or if they're worried they might need to be tested.
I mean, do you think the Chief Medical Officer warning it's just a matter of time before it spreads here? Do we have to resign ourselves to the fact that, you know, this is coming, a lot of people are going to be affected, we just have to work out how to deal with it?
We do absolutely have to work out how to deal with it. I think the thing that Professor Whitty is emphasising is that in the worst case scenarios, there are fairly dramatic things that we're going to have to do. Having said that, I think the thing that we do need to remember is that actually for the vast majority of people, even if they do catch this virus, actually the symptoms, whilst they're distressing, they're not terminal. They're akin to having a heavy cold or a flu. The people we really need to be most concerned about are the people who are most vulnerable. The people who've got their immunosystem is compromised or have got underlying health conditions. Those are the people that we're going to be focused on in the NHS in particular.
OK. All right, Danny Mortimer, thanks very much for coming in to speak to us this morning. That's Danny Mortimer, Deputy Chief Executive of the NHS Confederation. It is just coming up to